Welcome once again to Morning Ride on Delta Television. Yesterday, being May 17, 2026, the world marked World Hypertension Day. It is a day set aside to create awareness about high blood pressure, often described as the silent killer, because many people live with it without knowing. And the theme for this year's observance was controlling hypertension together. Check your blood pressure regularly. Defeat the silent killer. Well, to help us understand the dangers, prevention, and management of hypertension, we are now joined by pharmacist Gregson Idubofu. Thank you so much for joining us, sir. Good morning.
Good morning.
Good morning, pharmacist Gregson. It's good to
Thank
you very much. Why are you laughing now?
Let's just go straight to it. What exactly is hypertension, and then why is it often called a silent killer?
All right. So, hypertension to many persons, to several different persons, means different things. But of course, the general understanding of hypertension is, to the layman, is something that has to do with the heart.
Okay.
But to give it a proper definition, hypertension we describe as a persistent increase in blood pressure over a number of checks or days. Now, usually by standard, a reading of 120 over 80, that is systolic and diastolic, is considered a good reading for hypertension. But then, people will not get exactly 120 over 80 all the time. So we'll give allowance for, it's what we call plus and minus. You can say 120 plus or minus 10 over 80 plus or minus 5. So someone getting 75 as diastolic, 115 as systolic is also okay. Somebody getting 130 and probably 1 over 85 is also okay. So that is, but if you want to go into classification of hypertension, we now begin to see the primary hypertension.
Please go ahead, because my next question would have been, how common is hypertension in Nigeria? Are there different types of hypertension?
Yes, there are different types of hypertension. Of course, we have essential, then we have the primary. There is one of known cause. When there's another one that does not have a known cause. That is what speaks to that tag, the silent killer.
Okay.
Because sometimes you don't know where the hypertension is coming from. Don't know where it's coming from, but you just understand that the person has high blood pressure when the complications set in. So then, for the prevalence of hypertension in Nigeria, I would actually want to look at the global stage. Globally, about 1.4 billion persons are down with hypertension, high blood pressure. But out of these 1.4 billion persons, only roughly about half of them even know that they have hypertension, high blood pressure. And the remaining half, they are not aware.
Okay. Okay, so even as you follow up, I still want you to speak more on although you said silent killers, sometimes they are not signs, but I want you to also talk more about causes, risk factors.
Okay.
Then, growing up, we used to think, if it's a myth, please just let us know, that hypertension is majorly associated with elderly people. But in recent times, we've seen younger people that have even passed away as a result of hypertension. So can you draw the line for us to understand if it's age dependent, if older people are more susceptible, and the causes and risk factors that expose this one to this?
Okay, sure. Age is a factor, a predisposing factor to hypertension. Permit me to use hypertension, or maybe I will interchange with high blood pressure. But that doesn't mean that only elderly persons will come down with high blood pressure, come down with hypertension. Now, like you said, we've recorded cases where young people in their 30s, people in their late 20s, they come out, they are diagnosed with high blood pressure. Understand? So there are many factors that can predispose. For the elderly persons who understand that as they age, muscle function will decrease. And so the force at which the heart will pump blood, contract, dilate, all those ones they will do, or they will reduce. So that means that most
so
of these,
is that
apart
not supposed to call hypotension rather than
not really. For the elderly persons, they are this thing, it can be erratic for them. Sometimes some of them, you can see, I've seen several persons, elderly persons with blood pressure of around 80 over 50 or so. That's quite low.
And that's hypo now.
Is low. But for their age, we sometimes we tend to overlook them because considering the age of the person, you know that there is little that the art can actually do to raise it. But if for a young person like you, like for three of us here, if your blood pressure is 80 over 50, it's a cause for alarm.
Okay.
But as you age, we expect that most of these functions will also change. So as they change, you see, we need to notice them. But of course, that's why you see at the end of maybe people turning 80, 90, or 100 or so, you understand that something must kill a man.
Okay, so like Ogega asked, what are the risk factors and what are the causes of hypertension?
Yes, so like I said, one of the hypertension, let me quickly chip this in. There is what we call the family history. If you have a family history of hypertension, that is a risk factor to hypertension. Very important. So, for example, your grandfather, your great-grandfather had hypertension, you understand, and probably whether the symptom, it led to complications or not, but there was hypertension there. Now, it's very possible that down the line, some of the offsprings also can also come down with hypertension. So what do we tell such persons? That if you have a family history of hypertension, then you should now start taking your lifestyle more seriously. You modify your lifestyle. If you drink, if you take alcohol, I'm not mentioning some of the risk factors. If you take alcohol, you may consider stopping, quitting, or reducing it drastically. If you smoke, you may consider discontinuing. In fact, as a matter of fact, when it comes to hypertension, what we counsel people, we don't tell you to reduce your smoking. We tell you to discontinue smoking totally. For alcohol, we'll ask you to reduce your alcohol intake. But for smoking, you must reduce it. Then, of course, get busy. People that are sedentary, people that live sedentary lifestyle, they don't go out, they just sit morning and night, watch TV, then sleep, eat, and the rest of those persons. That kind of sedentary lifestyle is a predisposing factor to hypertension. Then, of course, another risk factor to hypertension, people that have diabetes. People that have diabetes, people that have kidney problems, they're also predisposing factors to hypertension, and vice versa. Hypertension can lead to and complicate those ones, just as those ones can also lead to and complicate hypertension.
Okay, when we look at the theme for this year, controlling hypertension together, check your blood pressure regularly, defeat the silent killer. My question is, how important is regular blood pressure checkup? And then, are there early warning signs that people should watch out for?
Okay, so if we go by the theme of this year, controlling hypertension together,
check your blood
pressure regularly, defeat the silent. Those three sentences we took now, they stand for three different approaches to manage hypertension. Now, one, controlling hypertension together, it means that it's a collective effort. You as a patient or as a person, the healthcare provider, you walk into a pharmacy or you go to the hospital, those persons are involved too. And then the policymakers or health systems, they are all involved in ensuring that people get adequate awareness about hypertension, and also to know how to detect the hypertension, early detection signs, warning signs, and the rest of them. Now, if we go back to checking your blood pressure regularly, yes, very important. We've mentioned before, more than twice here in this program, that hypertension is a silent killer. Now, when we say silent killer, it means that oftentimes hypertension does not show any symptoms. You know, that's why sometimes you just hear that somebody slumped and died. What happens? Say, village people. But when that person had hypertension, which has now led to complications like stroke, heart attack, and kidney disease, and the rest of them. So hypertension is a silent killer, but checking your blood pressure regularly helps you to detect it early enough. As I am now, if I check my blood pressure, I checked yesterday, and it was very, very, very perfect. 115 over 78.
That's when last did you check?
I checked it last month.
Last month, you see? So you should check regularly.
Yes, last month I did.
Okay.
When last did you check?
Last year, I think.
Okay, see now. So Rebecca, you need to check check your high blood pressure today after this program, or probably tomorrow morning.
You talked about sedentary lifestyle.
Yes.
Now, when you talk this hypertension, it can be quite tricky.
Yes.
Does stress also play a role on high blood pressure? Because sedentary lifestyle, there's no much stress and all of that. But what is the role of stress in high blood pressure? And also, something that we can all relate with, salt in our meal, excessive salt in one's meal. Because some persons, I'll call it seasoning cube.
Yes.
There's a particular name that we know it.
No, but
Yes,
that's a
but
seasoning
people,
cube.
there's the seasoning cube. Some people be like, if you just put only one, it's not enough. Or I like it. I like the way it tastes and all of that. So, does it play a role?
Yes, very big role. So stress plays a role. That is very, yeah, you must wait. Sometimes when people walk into the pharmacy or to the
So it's a
hospital,
risk factor.
it's a risk factor, yes, it is. Just as sedentary lifestyle is a risk factor. And there is no, I don't believe that
where's the
sedentary
balance?
lifestyle does not come with stress. So one can be sedentary, you can be not be doing
Yeah,
anything and still
true,
be stressed.
If you're sedentary, you tend to overthink. sometimes.
Exactly.
True.
So
I get
stress
that.
generally can involve both whether you are overworking yourself or you are not doing anything at all. You can also be stressed. Then you mentioned salt and
Seasoning cubes.
and the rest of them. Now that's because those are that sodium chloride. So if we go by the science, salt, that's the sodium chloride now, what it does is to thicken the blood vessels, and when that happens, it therefore increases the force. That's the contraction now, the force of the
Pumping
blood,
the blood.
pumping the blood, exactly. So that will increase the blood pressure. So to counter that, most times we tell people there's what we call DASH, dietary approach to stopping hypertension. So you now have to check the diet the person takes, reduce your salt intake, increase intake of potassium containing food like banana, leafy greens, you understand all this food, and then we encourage people to take all these ones. Then sometimes take potassium supplements. What this one does is to also counter the effect of the thickening of the blood vessels as caused by sodium and
Water
sodium.
therapy effective?
Water therapy is okay too. Yes, you can take water. Take water is very essential. We always encourage people to take water. Water, apart from detoxifying your system, keeping you rehydrated, also helps you with your blood pressure too. That's
Okay.
another one. Then I've mentioned that I've mentioned also address the stress aspect of it all. Okay, I think that's about
All
it.
right, let's talk about prevention before we talk about management of hypertension. What lifestyles can one adopt to prevent hypertension? And then if you're already down with hypertension, what lifestyle should you also adopt? What are the things you should do to help manage hypertension effectively?
Okay, the first thing you should do is check your blood pressure regularly. Very important. Check your blood pressure regularly, because there's what we say: prevention is always better than cure.
Yes.
So if you check your blood pressure on a regular basis, you should be able to detect when there is a change. And of course, you have this is not a question of saying I must go to the hospital to check my. No, that's not true. Every corner, they are community farmers. They call them community farmers. They are your neighbors. If you can't get any of them, then you may consider buying the blood pressure devices. They are very affordable. And of course, many organizations, all these NGOs and the rest of them, and in some cases some government agencies also, they distribute these blood pressure machines for free. Understand? So yeah, they do. So
you bring for me.
you only need to just put your ears down, be observant.
Well, you
You
can
see when they are
afford
doing
it.
that. So they are cheap. You don't need to wait for those ones. You can get the ones of
I used to
like
have
as cheap
actually.
as 25,000,
I used to have
30,000
it
or
before.
thereabout or so. Get them. You wake up in the morning, you check your blood pressure. Now there is one misconception that people have, that if they check their blood pressure regular, that it will make them to have high blood pressure.
Yes,
Okay.
because
Yeah.
That is fear.
Yes,
So-
yes.
so
I've seen a post. Maybe people say go for regular HIV screening, and someone said that thing you're looking for, you'll find it one day.
But it's
But it's
important.
not
You
true.
must check. You must check, because if you don't check, you will not know. And because hypertension is a silent killer, the only way to prevent that silent killer from taking you is to check regularly. Once you notice a spike, you start attacking it once.
Quickly, let's jump into your field. Now, some people, when it comes to medication, blood pressure medication, once they feel better, they stop. As a pharmacist, what advice do you usually give patients concerning medication adherence?
Okay, so fine. Now your blood pressure is high. Let's say 150 over 100 or so, and you see your doctor, and you are placed on medications. Now, medication, no doctor will randomly give you a medication. They would have gotten other subjective data, asked you certain questions, know the ones that are appropriate for you. They give you a medication, and you start using the medication. Usually, blood pressure medications are lifelong. That's something that you take for life. Now, that doesn't mean that you take them every day. There are some times where you'll be told, okay, you have to start skipping one day, or you have to reduce the dose of the medication. Probably you are using 10 milligram of a drug like, let's say amlodipine, sorry to say, and they notice that it has addressed your blood pressure to a very reasonable extent. the doctor or your pharmacist can advise you to consider reducing it to 5 milligram, or to start skipping one day. And there are things about on your own. You don't just check your blood pressure. So, oh, my blood pressure was 150 over 100 a month ago. Now it is now 120 over 80. So I want to stop my BP medication. On your own, that is not advised. You must also consult with your doctor, consult with your pharmacist before you take any action. And most times, we as pharmacists, we won't tell you to discontinue your blood pressure medication totally. So what we tell you is, okay, have it handy, still be checking your blood pressure, your blood pressure, and ensure that you carry out lifestyle modifications. Salt intake, reduce them or stop. Exercise regularly, take enough fluid, rest well and rest of them. So, but we also tell you that there is a place for medications, which you as a patient, you must also adhere to.
All right, Pharmacist Gregson Idebofo, as we mark World Hypertension Day, your last message to our viewer this morning.
Okay, for our viewers out there, I just want to encourage us to take our health seriously, check your blood pressure regularly, and know one thing: even though hypertension is, once you have it, management is lifelong, just know that hypertension can be prevented. It can be well managed. Now, prevented when you do the necessary things, check regularly, do the right kind of exercises, take the right kind of diet, you can prevent hypertension. Then, of course, if you have a family history of hypertension, then you must speak to your pharmacist, speak to your doctor on a regular basis, so they can counsel you on what to do, so you don't fall into that same line of hypertension. Then for Deltans, I want to also advise us that hypertension is not a death sentence. Some persons, once they dictate that they have hypertension, they are diagnosed with hypertension, they give up from one complication to another, because eventually they give up on the medication. So I want to encourage us: if you have hypertension, you are diagnosed for high blood pressure, know that it can be managed. If you are there to the counsel of your health care provider, you can live a very productive life with your hypertension.
Yeah, I must tell you that this discussion today, it was very hard for me, because I've lost someone who had to deal with hypertension, and I know that it's not easy. Well, like he said, it's not a death sentence. It can be managed very well. Thank you so much, Pharmacist Gregson Idebofo, for joining us this morning as we looked at World Hypertension Day, controlling hypertension together, check your blood pressure regularly, and defeat the silent killer. That was the theme for this year's observance. And we've heard Pharmacist Gregson, hypertension may be silent, but the dangers are real. So make sure you check your blood pressure regularly. Make sure you live a healthy life, exercise often, take enough water, and avoid drinking alcohol, avoid smoking totally if you can. And there's place for medication, so make sure you get proper medical care always. It can help to prevent and protect you from hypertension. That's all we can take this morning. Ogaga, let's have your final take as a wrap.
All right, thank you very much, Pharmacist Idebofo, for sharing your knowledge with us. I think you owe me a speak. You owe me a speak so I can check my blood pressure regularly.
When next I come, I'll come with one.
Okay, so I'll hold you to your word. So, like.